Patella tendonitis is very, very similar to shin splints in the way that you don't tend to get one incident that causes the pain. You say, oh, that's what I did this, I did that. With a hamstring strain, I sprinted, that's where I got my pain. If a medial ligament, I did a block tackle, that's where I got my pain. When it comes to looking at patella tendons, it tends to be a build-up of activity that tends to just fester and build and build and build up, where you don't feel any pain, and then suddenly one day you get pain in it. And the biggest question I always get asked, both from professional sportsmen and the general public, is, well, why does it suddenly happen now? Well, for me, it's because it's just built and built and built and built, and then that one, and it could be a very small activity or change of footwear or something, has just tipped you over that edge. Once it starts, that's then when you've got to get in the treatment into it. But often, as I say, these problems have gone on for months, especially weeks, if not months, and maybe even years, but never caused you a problem. And quite often in professional sport, we're able to scan people and use ultrasound scanning and MRI scanning. And you'll see that, even though they've only just had pain in it, oh yeah, they've got this kind of chronic patella tendonitis, and it's been there for years and years and years. They've never known they've had it. And I've done it where I've looked at a player, for example, for a medical, for example, in the past, and I found this, and yet they've never had any problems with it. And so it is that kind of problem, that it's not going to be one instance that's going to cause it. Having said that, when you get it, I believe in all of these injuries, you treat them exactly the same way. So straight away, you've got to get the area to calm down. You've got to get the inflammation, get in and out to that stage as quickly as you possibly can. So you've got to get ice onto it, 20 minutes at a time, and as regularly as you can in those first couple of days to get the tendon to calm down, which is basically what you're looking at. It's very agitated, it's basically inflamed. I mean, there's always this kind of debate of what it's called, whether it's patella tendonitis or patella tendinosis. For medical people, what that basically means is it inflammation, or is it just this kind of chronic injury that's happening and reaction that's happening? And actually nowadays we're going away from the tendonitis, because inflammation happens in the first couple of days and the first couple of weeks of an injury. But as I said, this actually happens, has probably been going on for months and months and months. So to call it tendonitis, potentially, or it's probably quite inaccurate, but that's what, as we know it as. But you're going to do your icing anyway, and you're going to try and get the tendon to calm down in those first few days. We would use electrotherapy as well, so using ultrasound, using laser, again, just to get that tendon just to calm down. It will quite often be swollen. You'll get an area of swelling around the area that you need to just get, again, to get smaller and smaller and smaller.